Santucci. Dr. Christina Malik is an assistant professor of pediatrics in the Department of Pediatrics at University of Colorado School of Medicine. She is on the faculty of Special Care Clinic, a medical home and consultative pediatrics practice for children with medical complexity at Children's Hospital Colorado. She attended medical school at University of South Carolina and then pediatrics residency at Bay State Medical Center in Springfield, Massachusetts, and then joined an inpatient outpatient complex care program at Children's Hospital Montefiore. She joined the faculty in Denver in 2019. She has since started a journal, complex care journal, co-edited by Dr. Rishi Agrawal, which focuses on data on children with medical complexity. Dr. Santucci Malik Dr. Courtney Santucci is also an assistant professor of pediatrics on the Special Care Clinic for faculty. She completed medical school pediatrics residency and a year as the assistant residency program director at Emory University. She has worked as a hospitalist in Chattanooga, Tennessee, where she started an inpatient outpatient program for CMC, then joined the faculty in Denver 2013. She's a primary care physician to over 200 CMC and medical director of the Ehlers-Danlos Clinical Program at University of Colorado. Dr. Malik and Dr. Santucci, I'm going to turn it over to you. Thank you.
Thank you so much, Amy. Neither Dr. Malik nor myself has any conflicts of interest to disclose. And our views don't necessarily represent the AAP's views. So our objectives for this talk are to first define the needs for mental health care services for children with medical complexity and their families, to compare the mental health needs for children with medical complexity and their families before and now during the pandemic, and to discuss, and hopefully we'll spend the majority of time discussing practical strategies for providers in providing mental health supports for children with medical complexity and their families. Next slide. So first, I think it's good just to define children with medical complexity. They are a subset of the population of children known as children and youth with special health care needs. Children and youth with special health care needs are those who have chronic physical, mental, developmental, or behavioral conditions. These can be a broad diversity of conditions, including asthma, obesity, diabetes, depression, or developmental disabilities. And as a group, those children make up about 15% of the US pediatric population, or about 11 million kids. However, if we then look more narrowly at just those children who, and if you look at the graph there, just those children who have multiple areas of diagnostic and therapeutic and functional needs, that's the group that we'll focus on today, hopefully. Children with medical complexity, multiple diagnoses, need for multiple medications, therapies, oftentimes having functional limitations. Next slide. So the thing is that when it comes to the literature on mental health care needs in children with medical complexity, there's not a whole lot. We can maybe extrapolate from the data about mental health care needs of kids with chronic conditions, but not a whole lot specific to CMC. So one paper, though, that does focus on children and youth with special health care needs, data that came out of a large national survey done in 2009 to 2010, which was then kind of further extrapolated and parsed, can tell us that there is a level of unmet need for mental health care services amongst this pediatric population. In those study years, about 14% of kids with defined mental health care needs receiving only some of the needed care, and about 6% receiving none of the needed care. And you add those two groups together, about 20% of kids with chronic conditions having unmet mental health care needs. Next slide. So another review. So this is an analysis of national survey data that was pulled together by a team from Harvard, looking at the national survey data from the 2000 to 2002 interval. What they tried to define is, amongst children with special health care needs, what is the burden of mental health care needs in that population? And what they were able to define is that if the underlying diagnosis at play for the child is a diagnosis that impacts on emotional or developmental or behavioral health, then there's 2/3 of that population had defined needs for mental health care. And additionally, only about 8% of children with chronic conditions who did not have an emotional, developmental, or behavioral component to their diagnoses had a mental health care need. I think the most kind of interesting nugget of information out of this review, this paper, was that about a third of family members of kids who have chronic healthcare needs, of those who have an emotional, developmental, or behavioral component to their illness, the family members have a defined mental health care need. So if we're taking care of a population of kids who have chronic conditions, especially if there is an emotional, developmental, or behavioral component to that, then there's about a third chance, at least, that the family members also have specific needs that we could help address. Next slide. Okay, so how many of those children and youth with special health care needs are children with medical complexity? Several have and are always trying to define that number. We might estimate that it's probably around 8% of all kids with chronic conditions are medically complex, and that totals up to just about 1 to 2% of the total US pediatric population. So a small number, but a number of patients, as we're all familiar with, who have kind of challenging needs and high healthcare utilization. And one group, actually, this is Dr. Rapeng's paper from 2016, attempted to define specifically for children with medical complexity, how well are we doing over the interval of 2005 to 2010, at least, at meeting mental health care needs. And what he published is basically that there is an increasing amount of unmet mental health care needs over that survey interval, and that older age, poor socioeconomic status, that these were risk factors within the group of children with medical complexity to have unmet mental health care needs. So maybe some data that can inform who we should be most worried about within our clinic populations. Next slide, please. Okay, so pre-COVID, and I'll stress that, pre-COVID, what can we know about the level of that unmet need? This is again from Dr. Rapeng's 2016 paper. The numbers shook out as are stated here. So if we look at children without medical complexity who just have chronic conditions, in the earlier part of the survey years, 2005-ish, about 4%, climbing to almost 6% toward the later survey in 2009, 2010. But if the children had medical complexity, much higher chance of having unmet mental health care needs, from about 10 and then up to 14% over those survey intervals. Next slide, Amy. So, okay, is it the complexity or the other socioeconomic factors that are making it hard for children to access their needed mental health care resources? And this was a question, kind of, I think we can take some answer from Dr. Ko's paper. And this sort of attempted to look at inequities of healthcare delivery for children with medical complexity, basically concluding that while certain socioeconomic factors broadly do impact on healthcare access and delivery, these including race and income and insurance type, that amongst children with medical complexity, that seems to be its own and independent risk factor for having unmet needs. And these are not just mental health care needs, but really unmet needs broadly, which were assessed by the National Survey of Children's Healthcare. Next slide. Okay, so most recently in the last 4 years, the type of survey data that we will have available to us to study these issues, it has changed somewhat. So those papers that I was just reviewing all come out of data from somewhat older surveys, and the most recent 4 years have shifted. They're now conducted not by the CDC, but rather by the Census Bureau. And rather than being a telephone-based survey, it's now a written or web-based response survey. There have been some changes to the questions that are in the survey. So this raw data, if you're ever interested to look at it, does exist for all of our review. But as of yet, at least as far as I could find in the published literature, there haven't been sort of secondary analyses of the questions of mental health care adequacy or delivery specific to children with medical complexity from the most recent 4 years. But a great resource for all of us for healthcare data for children with chronic healthcare needs. So in summary, just to review the national survey data available to us, children with medical complexity make up about 8% of kids with special healthcare needs, and those are about 15% of the US population. Being a child with medical complexity predicts a higher risk for having unmet mental health care needs. And that unmet need was increasing up to around 14% based on the most recent published data from 2010, which were then published in 2016. So with that background, I'll toss it to my colleague, Dr. Christy Malik, who's going to review our experience at Children's Hospital Colorado.
Hey everyone. So locally, our mental health needs, our colleagues have a manuscript under review, so there's not a whole lot of data I'm able to share with you today, but at our clinic here, the special care clinic, we have found pre-COVID that there was increase, 1.5 times increase in positive maternal mental health screeners compared to other high-risk populations at the Children's Hospital here. And then about 50% of our families within our clinic have screened positive for needing socioeconomic resources. Next slide. So I'm going to transition to the second part of our presentation about, where have children with medical complexity received mental health services pre and post COVID, and what are the unique needs that we've been seeing here. So pre-COVID, children with medical complexity often received mental health care through community mental health centers, ambulatory clinics, if you have an integrated program, or in developmental peds, or in-home through therapies. And then another location is the school, and it's a unique location because unlike some of these other services, schools don't require a diagnosis to provide services. So that can be a place, especially in children where they're kind of like pre-diagnosis, to help support them, can be very useful. Though post-COVID, as we know, pretty much everything came to a halt in the spring during the shutdown. And this summer we've started to see services restart, initially through telehealth and some being in person. We know anecdotally telehealth and also in person in the post-COVID world are not ideal for everyone, whether, telehealth has a lot of barriers, and then in person, if a family is trying to isolate themselves, it might not be ideal. And just to kind of put in the post-COVID world, we don't really have a whole lot of research saying that also, like, whether telehealth or in person is better for mental health care needs. We've seen it in our clinic that it depends on the family and what their need is, and but definitely it's there's not a great answer right now. Next slide. So what are the mental health needs that we see in children with medical complexity? So this is just in general, some things that we see is for patients, we often are talking about problematic behaviors, whether it's related to an underlying diagnosis or developmental disability. And then, or also kids who have new diagnoses, coping with those diagnoses. Families we see, and siblings we see, coping with the complex siblings or child's mental health care needs. And then also, the unique parenting strategies needed for children with medical complexity, especially with significant functional limitations. The baseline stressors that we often see for families is managing school, therapies, nursing, financial resources. And then specifically, novel stressors we've seen during COVID anecdotally is telehealth is not ideal for ABA therapies, that the interruption to the home health services and school-based services have really impacted a lot of our families, and that there's stress over COVID-related health risk, stress over being able to come into the hospital if a child is sick and their family wants to visit them and along that lines, or be there with them. And then, and along that line, there is one recent study out of Italy showing that, for families with children with autism, that there has been like a 94% of families reported there is a disruption in providing care at home. So, we do know we see them clinically, but we also know that these are novel stressors that multiple families are reporting. Next slide. So these are some paraphrases from families that we've heard, and I'm sure you've heard something similar in your clinic as well. Next slide. So the going forward with kind of the novel stressors we've seen during COVID, we have some recommendations. We have some clinical psychologists on our staff, and we have talked through some of the things that we've been seeing, and they've helped us with some of the discussion points they've been talking to with families and that we've been talking through with families. But so for children with medical complexity, one of the biggest things we've seen during COVID is a loss of routine and the increase of problematic behaviors. And our discussion points with families around this have been talking about, not waiting for things to normalize, that this is our new norm and to make new schedules now. Especially a lot of families had, routines and schedules related to the school schedule. And since now school is a new thing and completely different, let's adapt those schedules to home life and what works well for the family rather than the school. We often have conversations about risk and benefits of therapists being in home, as a lot of families identify it's really helpful to have them in home, but the risks are hard to sometimes talk about and bring in someone. And then also what's the biggest post-COVID need for each family member, and making sure that we look at the whole family and making sure to address all their needs, even though the complex child might be having more outbursts or something more visible, recognizing that everyone in the family has something during this time to address. Next slide. For siblings, we have definitely seen increased stress from either a complex siblings' behavior increases during COVID, or the uncertainty about bringing COVID home, or being exposed to COVID and bringing it to the family and their complex sibling. The discussion points we talk about with families here is definitely a balance of risk and benefits. For example, a sibling who returns to school might be able to study better and without the behavioral interruptions. On the other hand, a sibling who stays home might feel like this is a less risky situation to expose the family to COVID. The one suggestion is definitely talking about this as a point of resilience, and this is the new world we're in, and how are we going to learn from this and take these challenges and make them into new opportunities. And then along that same line, asking siblings for suggestions on the situation, I think, is really helpful here, because a lot of times they've thought about this and they have something to say. Next slide. For the family and the parents, and the guardians, we definitely have seen a lot of increased stress and anxiety from this new normal. We have a lot of things depending on where the family is, to talk about meeting where they are and what kind of concerns they have. But definitely if they're able to, and they're thinking about the risk and benefits of going back to school, to help with care or like giving them more time to work and things along that line, that's definitely a discussion to have. But then also making sure the family recognizes that they need to take time for themselves and provide themselves self-care. A lot of times families forget about this, thinking about, the parents are forgetting about this, thinking about their family. So we often talk to families about self-care. When are 5 minutes you can take for yourself? One parent, was like, well, as soon as I hook up the G-tube feed, my child is calm for a little bit, I can take some time for myself. And while it's not enough, it's definitely a start, and that's all we're asking for families right now. Taking advantage of the resources you have. A lot of families have a fair amount of resources, and they need to think about how they can use those resources they have for their own benefit. Reflecting on how have you coped during hard times before. All families with children with medical complexity have had hard times. It might look different, but how have they gone through hard times before? Reflecting on the potential benefits that have come from the COVID change, and also reminding families of the connections they already have. So not only the resources, but their friends, the support groups they have, online supports that they have available to them, and if not, helping them find those supports. Next slide. So overall, our psychology takeaway from the post-COVID world, early and universal screening. If you don't have something in place now, this is a great opportunity to start, and it can be formal or informal. We know that through some studies that EPDS scores, or perinatal mental health scores have increased during the COVID period. So, you know, in this population that's at higher risk, they're likely to be also increased. Doing something as simple as an informal screen, such as, you know, what are the hardest things for you right now and what are the best things that your family is doing right now, can open up a conversation. Second thing is meeting families where they are. Not everybody might be ready for formal services, especially with reduced access and wanting to stay isolated. So some things we've done here is make a resource list, and we will share some resources that we have for you, or that we share with our families to you. And some of these resources can be as simple as some apps. There is a new mental health app from Cincinnati Children's called WISA, and it's specifically addressing mental health surrounding COVID. There's also one of our parental favorites is the CaLM app. Talking with school services about what support they can provide is a great way to start with family with services. One, because like I said, they don't necessarily require formal diagnosis, but two, they also don't require transportation if the kid's already going to school, or if they're getting virtual school, that's an option. And being present with your family during their visit and hearing what they're having to say, sometimes that's the first step forward in meeting them in their mindset where they are. Finally, the third step, helping families make that first step forward when they are ready, whether that's a formal referral or just guidance on that new normal or self-care that we've talked about earlier. Reminding them that the supports that they have and the supports that they can reach out to, these are all ways to help them make that first step forward during this hard time. All right, final slide, please. So I want to acknowledge that this presentation wouldn't be possible without our clinical psychologists, Vernia Serrano and Jonathan Schultz. They are, you know, helped us immensely throughout all this, and I really appreciate all their support in developing this presentation.